There's more evidence now showing vitamin D is important when it comes to surviving a case of COVID-19. In fact, a new study shows the risk of severe infection could almost double in those who are vitamin D deficient. A specialist from St. Luke's explains what that could mean to you.
You get vitamin D naturally from sunlight and certain foods, but 3/4 of us don't get enough. When you're vitamin D deficient, you're more susceptible to infections. St. Luke's cardiologist Dr. James O'Keefe, who has studied the effects of vitamin D for years, says it makes sense to watch your levels during this pandemic.
If you're vitamin D deficient, you're more likely to come down with COVID. And number two, that if you're vitamin D deficient, especially if you're really deficient, you're much more likely to have a severe course, end up, in respiratory failure, on a ventilator, dying from it, sort of thing.
Dr. O'Keefe says he takes vitamin D supplements himself and recommends them to his patients, but adds it's a good idea to get a blood test first to know exactly how much to take.
That being said, most people need to take about 2,000 units of vitamin D3 to keep their vitamin D levels in the normal range. So that's a reasonable thing to do for people these days.
Some people have a higher risk of not getting enough vitamin D, especially those with dark skin and adults over age 65. When it comes to COVID-19, there's still a lot more research to be done.
In my opinion, there's never been a more important time to keep your vitamin D3 levels normal, just because of this dangerous virus out there.
Now remember, taking vitamin D does not take the place of masks or social distancing, but it could protect you from a more severe case if you are infected. Dr. O'Keefe also recommends getting outside more while the weather's nice, get some of that natural vitamin D from the sun.